Not a single Republican voted in support of the Affordable Care Act back in 2010. That includes San Diego Congressman Brian Bilbray. He joins me from Washington. Thank you, Congressman, for taking the time.
Great to be with you.
Now, we know that the House Majority Leader Eric Cantor says the House would vote to repeal the health care law. Where do you stand on this?
Well, I've actually introduced a bill with Congresswoman Maloney, a progressive from New York, to take the sun tanning tax from the Obamacare funding and shift it over to melanoma research. So we're looking at the fact that right now the projections of the cost of the health insurance system, and you understand this is not a health care system, it's an insurance system, is about twice of what was projected when it was passed, and the revenue for it, the ability to pay the bills, is about half of what it is. So the real crisis here in this system is Washington has promised a lot, and now we don't know how we're going to pay for it.
So just to clarify, you wouldn't vote in support of repealing this law because there is part of the law that really your new legislation relies on. And to follow up on that, when you talk about cost, now according to the Congressional Budget Office, it says this law will actually save money in the long run, that if you look over the next 10 years and 20 years, it actually helps to reduce the deficit.
No, it actually double counts Medicaid care money. Medicare money, and it has 10 years of taxes with only 6 years of services provided. So the first 10 years, you've got sort of the sham of being able to tax for 10 years that only provides services for 4, and that may look good initially, but when you go with long-term projection, the cost is actually doubling up on what we projected it was going to be. And that's one of the items that really comes down with this. And now with the Supreme Court ruling today saying the individual mandate is not constitutional, but the Congress does have a right to tax the middle class any way we want. This is probably the largest tax specifically on the middle class that we have ever seen, at least in our lifetime.
I want to bring it home to San Diego now because, of course, you represent San Diego voters. Here in this county, the law means that 200,000 of the county's 600,000 uninsured will have health insurance. How do you tell them that's not a good idea?
Well, because if they don't have doctors in the next 5 to 10 years to go to, an insurance company, doesn't, you don't worry about that. Also, the fact that we've got the companies that are being taxed severely. The people that making the medical devices and stuff, they're being hit hard with this issue. But the biggest issue, as anybody would say in the environmental community, it's a promise that's not sustainable. When you say, we'll give you insurance, until what time and when does the money run out? There was a big reason why California had not gone to universal health care. There's no way that California, if they could afford it, wouldn't have done this a long time ago. But the problem is you've got to cut the cost of health care. And there's 2 things that need to be done. The Republicans have got to be willing to take on your insurance companies and break up the state monopolies, allow cross-state purchase for consumers. But the Democrats have got to look their friends and their major contributors in the eye and tell the trial attorneys that, look, you can't be taking out as much as you are. That why does somebody on Medicaid have more right to sue than a Marine serving his country? So we need to do both of those things before any of this is going to be affordable.
I want to step in here. We haven't got a lot of time, but you have been public about your own family's experience with the healthcare system. We know that your daughter has been struggling with cancer and she has insurance. But if not for this law, your daughter going forward would have to buy her own insurance. She would be uninsurable. How do you respond?
Oh, absolutely. That is why I said that we've got to sit down before we make the promises that Brianna, who's going through cancer treatment right now as we speak, we got to be able to afford to pay those prices or she won't have any health care coverage in the next 10 years. And that's where both sides, again, have to figure out how to lower the cost. And just forcing everybody into one big pool that's sinking doesn't solve the problem. What it means, Republicans have got to tell their friends, the insurance companies, we're breaking up your monopoly. But the Democrats have to tell their friends, the trial lawyers, to say, look, we can't afford to have the kind of litigation and make the system cost effective. And I know this.
I have to leave it there, Congressman. We're out of time. We're out of time. I'm going to have to leave it there, but thank you so much for being with us.
Thank you very much.